Oh, when you're riding motorcycle, you're negotiating with the road, you're negotiating with people, you have an opportunity to get the wind blowing on you, and you feel a sense of freedom that it's very hard to achieve, driving a regular car. When I was 7 years old, I had an accident. I got about 60% of my body burnt. I spent 6 months in the intensive care unit. I became very aware of the difference that the nursing profession and the physicians can make in a life. And it was back then when I decided, I realized I had a little inclination towards the medical field. When I finished my tour of duty with the Air Force, I was basically a general ophthalmologist. I was board certified, and I still felt like I had some areas that I didn't know a lot of. That prompted me to look for. I just wanted to learn more about it, and I applied for different fellowship programs, and eventually I was accepted in the Houston program. And with Dr. Charles Garcia at the University of Texas in Houston. I spent 2 years training, learning how to manage these things medically and also surgically. My father was really a fanatic of the opera, and I've been listening to opera since I have memory. And I've also been listening to the violin. He used to take me to concerts, and at the time when I was 6, 7 years old, I didn't realize that what he was doing for me. The arts in general expand your brain capacity. When you stimulate a child early in their life with music, arts, these things open their brains, so to speak. They open their brains, and they become more. I think they become better thinkers. They learn to enjoy life better. Music to me has always been very rewarding. Just to sit, listen to the sound, the fullness, the richness, the virtuosity of the performers. That's actually very spiritually feeling for me. I say kiddingly, but really it is true that a lot of times, rather than seeing a psychiatrist, I would just go and play my guitar, and that took off the edge, the anxiety, and things that develop through your career. So that, like I said, for me, my family I've always encouraged music. I heard the saying that it's if I had known that the grandkids were so much fun, I would have had them before my own kids. But now I understand what they mean. Of course, I had to travel because I was with the Air Force, and they would move me occasionally, once in a while. It was not really until we came to Mississippi, and we have stayed here for the last 25 years. That's when they had the opportunity to really put roots, and I came originally with 3 boys, and then later I had 2 girls, and I'm very proud of all of them. Now I have 2 grandkids, a boy and a girl, so those keep me very happy. That's nice. There's a sense of legacy. I don't like to think about Southern Eye Center like an individual practice of someone, and then they retire, they sell their share of the practice, and then they move on. One of the beauties of the way we have our system is that each one dedicates their efforts to a specific area of expertise in the eye. We have this camaraderie that we can consult with each other in the hallways. There's only a little door that separates each one of our pots. So it's very easy to offer very, very high quality eye surgery and eye management of eye diseases, simply because we work together, we work in conjunction. We don't see each other as competition. We actually enhance each other's ability to provide better outcomes for the patients.